the dramatic changes cataract surgery can make in a patient's vision already have many of them saying, seeing is believing. But now ophthalmologists have set their sights on even better results. Visionary and ophthalmologist Dr. William Wiley from the Cleveland Eye Clinic is here to focus our attention on a new type of eye-opening lens. Thanks for joining us today.
Sure, thank you.
So tell us about the new lens.
So there's a new lens called the Light Adjustable IOL from Calhoun Vision. We're one of the first practices to be involved in a clinical study that can provide this lens.
And this is a lens that would go in somebody's eye.
Sure. So what happens with cataract surgery, we take the cataract out and we replace that cataract with a new lens. And traditionally, the lens is sort of a fixed lens. Once it's in there, the vision is sort of locked in. So there's a chance we could be off a little bit, or patients will need glasses to fine-tune their vision. What's nice about the Calhoun lens, this light adjustable lens, once it's in place, we can use light to fine-tune or adjust that lens to basically match it perfectly for the vision, sort of customized for their eye.
How does the lens do that?
So what's interesting, so the way the lens is made, it has some polymers and macromers that are photosensitive. So once the lens is in place, the eye heals, and then we use a special light therapy that can adjust that macromer or that photosensitive material to fine-tune it to match their eye.
Huh. Are there risks?
Sure. With any surgery, there are risks. As far as cataract surgery, we talk to everybody about what those risks and benefits are. So we go through that with the patient prior to surgery.
So does this lens create more risks than a normal cataract surgery? Or is it about the same?
Basically the same. So it doesn't really increase any risk for cataract surgery. In some regards, it's safer because it allows us to adjust that lens once it's inside the eye.
Now, this new lens, which sounds pretty good, it's not yet available for people generally. It's in research.
Sure. So right now it's available in Europe and Mexico, but in the U.S. it has to go through the FDA approval process. So it goes through clinical studies, and right now we have that ability to offer it to patients through a clinical study here in Cleveland.
So you're doing a study,
yes,
offering, and people can come in and you would put this lens in?
Yes, exactly. So what we do is make sure that they're a candidate for the study. For example, you have to be between 40 and 80 years of age. You have to have a cataract, and there's some certain qualifications that you have to meet to be, entered into the study.
What are the qualifications? Are there age qualifications?
Yes. So age and sort of health qualifications, depending on the health of the eye. You have to make sure that the eye can tolerate cataract surgery or tolerate this type of lens.
And will there be a charge for people if they sign up for this study?
Sure. Great question. Right now, for example, in Europe, the lens is quite expensive. It's probably $4,000 or $5,000. But here in the U.S., since it's part of a clinical study, we're allowed to provide it to patients at no charge. Wow. And actually, there's some compensation because it takes a couple extra visits for the study purposes, so the patients can get compensated to be part of the study.
And if our viewers want more information, possibly to sign up, we're going to give them a phone number.
Great. Thank you.
Thank you for coming in.
Sure.
As you can clearly see, this research study could help you clearly see. For more information and to see if you could participate, give the Cleveland Eye Clinic a call. The number's next. My thanks to Dr. Wiley for giving us a sneak peek at this latest lens.
For more information, call the Cleveland Eye Clinic at 330-888-5127 or click to www.clevelandeyeclinic.com. Next, avoid costly mistakes when taking money from your IRAs and 401ks.